I'm Dr. Amy.
And I'm Ashley.
And we're going to get you
back in the game.
Hi, everybody. Welcome to weeks 4 through 6 for your post-op knee rehab. I'm here today with Ashley. Hi, Ashley.
Hi.
We're really excited to bring you this video today. If you've been watching us through your journey, we've been trying to give you a lot of goals for each couple weeks and some things to shoot for.
Dr. Nada, what kind of goals are there?
So the weeks 4 through 6, we really want to start seeing you getting increasing that range of motion on the knee, primarily flexion and extension. The other thing we really want to see is you to start strengthening your quads. So the muscles in the front of the thigh, we really want to get those nice and strong. Another goal this week or these next couple weeks is to increase your functional activities. So the things that you were doing before that you may be limited on. The other thing we're going to talk about this week is something called proprioception, which sounds like a really big word.
So Dr. Nada, what is proprioception?
So proprioception is the body's ability to know where it is in space. So to give you an example, you can actually do this at home. Close your eyes and then put your arm out in front of you. You know that your hand is 3 or 4 feet out in front of you. That's proprioception. Why is that important in terms of rehab when it comes to the knee? Is you need to be able to balance on that knee. That's what proprioception does. It allows us to balance and have that balance that we need if we were to close our eyes and stand on one leg.
Okay, so since patients aren't standing on one leg very often in their everyday life, does that lead towards any sort of other functional stuff that they might be doing?
Yeah, great question. It's actually really important in terms of your gait, how you're walking. So when you walk, you do at one point in the cycle of walking, you do stand on one leg. Mm-hmm. So it's something even as basic as walking.
Great.
Yeah. Like every other exercise, before you do these, please make sure you check with your surgeon. Every surgeon is a little bit different and has a little bit different guidelines. These are just some general guidelines for weeks 4 through 6 for your post-op knee rehab. All right, so we're going to start out with our first exercise. So we had mentioned that proprioception is one of the goals for this week, and we talked about what that is. Really important to be either barefoot or sock foot, because the bottom of the foot contains a high concentration of proprioceptive receptors that you can't necessarily feel with a shoe on. So it's going to increase your body's ability to have those tiny little nerve endings fire as you're regaining your strength.
Okay.
Before you start this, you want to make sure you have something to grab onto for some stability. You want to just kind of not really grab onto it because you want your body to do a lot of the work. Just use the fingertips of your hands just in case you lose your balance. You can do this at home actually with just a pillow. Now what we have done here is we actually had to fold the pillow in half because it was too flat. So if you have a very flat pillow, you may have to fold your pillow at home.
How should I have my leg completely locked out here?
Oh, definitely do not have your knee completely locked. We want a very slight bend in that knee. Now, if you want to make this harder, if you're really adventurous and want to make this harder, you can actually close your eyes and do it. And you'll notice you might start to get a little more wobbly. I would normally hold it about 30 seconds. So for this next exercise, it's pretty self-explanatory. It's called step-ups. So there's not really much explanation here. You're just going to practice going up the stairs, up and down the stairs on the side of the surgery. Pretty self-explanatory. You're going to do 2 sets of about 10 to 15 reps. One way you could progress with this exercise would be to add ankle weights at the bottom or as you progress. All right, so the next exercise we're going to talk about is squats.
Dr. Nada, what if you can't do a squat? Like what if patients, they don't have that much motion or that much balance? What would you say?
Great question. Honestly, just do your best. So at this point in time, you should be able to get in some sort of squat. You should be able to bend your knee. If you can't do a squat at all, for whatever reason, or can't even bend your knees to even try to attempt it because of swelling or pain or any other type of issue that just prevents you from doing it, you probably need to call your surgeon. So the most important thing is to do what you can without sacrificing your form. Make sure that you put equal weight on your feet as you squat. Otherwise, you will end up having an off balance or end up with one leg straight, or arching your back too much, or putting too much pressure on the opposite side hip. So for the next exercises, we're going to be talking about exercise bands. Now, these can be purchased on pretty much anywhere. They're very low cost, but they're a really great way to rehab any type of knee problem. All right, so for our next exercise, we're going to talk about the resisted march. So if you have some bands at home, we encourage you to use the bands. If you don't, you can do this without the bands as well.
And Dr. Connor, when I'm marching, should my body be going back and forth?
No. So we want your body to stay in your torso to stay still. We want all of the movement to come from those hip flexors, bending that knee. Again, having good form, making sure you're stable on your foot. You may notice a little bit of wobbliness, especially on that surgical side, but try to keep in mind that you want to just keep your body nice and straight. We don't want you swaying from side to side. So for our next exercise, we're going to talk about band walks. Again, you can do these with or without the band. When you first start, you can do it without the band and then gradually increase the resistance with the bands. You're just going to take a couple steps to your left, a couple steps to your right. You want a slight bend in your knee, equal weight on each foot.
So, Dr. Carr, with this one, would you say it's like the same with the marches we just did as for kind of that rocking?
Yeah, we definitely don't want the rocking side to side. We want the upper body to kind of stay quiet, as we call it. We want it to stay nice and still. We want everything to be done from the waist down.
And at this point, would you think that patients who have had a knee replacement should still be needing their walker for assistance? Or a cane or anything?
A great question. By week 4, we really want patients, or we encourage patients to be, we call it non-assisted with any type of mechanical assistance. So no walker, no cane by week 4 at the very, very latest. Okay. Now again, if you're not there without assistance, that's okay. Just do your best, but we want to, by week 5 and 6, be completely device assisted free.
So, Dr. Kanata, what about the exercises that we talked about for weeks 1 through 4 up to this point? Should patients continue to keep doing that stuff?
Oh my gosh, great question. I know a lot of patients think like, well, I'm done with those. I've moved on to bigger and better things. And the answer to that is no. Do not stop doing those things. Those things are really important. We're just adding to what you're already doing. So instead of your exercise time maybe taking a little bit less, you're going to be spending more time doing exercising just to get that strength back.
Okay, so they should continue to do the bike and trying to move forward with going around on that?
Yeah, good question. So the bicycling, we talked about that last week where we were having them kind of alternate back and forth if they couldn't go through the whole arc of that whole cycle with your knee. We would like you to try to get through that whole bicycle arc at this point in time. If you still can't, that's okay. Just continue to rock back and forth and continue to push yourself through that full circle with that on that surgical side.
Okay, so at this point, if patients can't do some of these things that we said that they should be able to do at this point, I mean, what would you say to those people?
Just continue to do your best. Work as hard as you can. Your physical therapist is going to continue to push you a little bit, but just do what you can. We hope you enjoyed this week's video, and with anything, these are just some suggestions and some guidelines of the things that you can be doing and should be doing at this point in time. But don't beat yourself up if you can't. Just do your best. Make sure you check with your surgeon, and we really enjoyed doing these videos with you.